I have to say I'm absolutely thrilled that Breaking Depression has won the Prevention and Awareness category of the 2021 Connecting Healthcare Awards. Thank you. Let me tell you a few words about Breaking Depression. This is a health awareness campaign that launched back in 2019. So we're speaking about a multi-annual campaign. And it aims at raising awareness of the challenges of living with different types of depression, including major depressive disorder, by telling patient stories through the Japanese art of kintsugi. And now a few words about kintsugi, a very interesting art technique which looks at broken objects and repairing them through putting them together with golden lacquer. Kintsugi actually means golden joinery. And through this way, we look at an object's history and at their cracks, not as something to be concealed, but actually celebrated. And there is a parallel to managing MDD, major depressive disorder, because we respect the cracks and we recognize that repairs take time and are very complex. And just to acknowledge our partners, so together with Guinea Europe, but also with people living with depression, with carers, and with health professionals, we aim to encourage more open and honest conversations about depression so that at the end of the day, we can be able to take better care of our dear ones and of ourselves.
The campaign itself has contributed to reducing stigma that surrounds mental health and, in this case, depression. We know that 1 in 4 people will be personally affected by mental illness, such as depression, during their lives. Despite this, 75% of people diagnosed with depression will not receive appropriate care. Stigma and common misconceptions about depression can prevent people from opening up about how they are feeling. So the videos featured in the campaign have shown that the healing process is a complex and difficult journey, but that the process of dealing with depression and getting better can be beautiful and represent the strengths of the affected individual. Often patients are ashamed of their perceived broken parts, the mental health problem. But through the ceramic art project, the broken parts are highlighted as something original and different. And it is this difference that makes the piece of art beautiful. The campaign has also helped start conversations about different types of depression, including MDD, and encouraging more open conversations. Often the most difficult part of dealing with a mental health condition is talking about it to others. Many patients often identify the first conversation as starting point of a healing journey, I would say. Encouraging people and guiding them through this process of talking about their mental health is essential. And this project has definitely helped patients and their loved ones do so. Together, we can help break the silence around depression, break the stigma and misconceptions, and ultimately help those living with the condition get access to support that they need.
It's very correct to assume that collaboration was actually the key word in our project. And I realized and I have learned from my experience that once people see and understand the purpose and the meaning of an idea, they all rally behind it. And as we know now more than ever, mental health is a cause which touches each and every one of us. So that made partners be very receptive and engaged with breaking depression. And last but not least, there were two big dimensions. So collaborating internally to make the campaign happen, but also collaborate externally. And these two dimensions present different sets of complexities. But I have learned that with a very strong team and that meaningful idea, I mentioned earlier there, an articulated purpose along the way, all can be overcome. Compliancy and transparency are at the heart of everything that we do. So we paid a lot of attention to these two aspects. And I can give you some examples of how we made it come to life. We have ensured that the guidance on patient safety and also pharmacovigilance was strictly adhered to. I have another example. We have worked closely with the Janssen local affiliates to ensure that the localization of the campaign was conducted in line with local regulations and, of course, met the required legal standards. There's another aspect. We have clearly stated that the campaign was developed by Ghanaian and Janssen, and we have included the Janssen legal entity on all materials. So you could track down Breaking Depression to us. We have also been committed to act and be fully transparent with Ghanaian, but also all other partners regarding the use of any materials that were collaboratively developed, and we have sought their approval before using them. And last but not least, of course, all the materials received the formal approval through our online review platform prior to issuance. Bring in authenticity. I believe that having a blend between science, ingenuity, and heart is key. And also think of the values of the collaboration, the values you want to bring in the collaboration. For example, empathy and respect are essential when dealing with patients and carers, of course. There's another side to it, which is the project management part of the discussion. I would say that having clear objectives, clear milestones, and be on the same page regarding expectations is as well important. But also measure, so you can reevaluate and tweak as you go. I don't know what Nigel thinks about it. What would be your piece of advice, Nigel?
Thank you, Christiana. First of all, I think it's important from the beginning to establish common goals and objectives at the beginning of this sort of project. A strong partnership and clear understanding of what both organizations or both partnerships are setting up to achieve and how to achieve it together is absolutely crucial in this journey of the project. Another point I would like to make is originality and creativity for raising awareness and carrying out campaigns on mental health. It's important to push the boundaries and to continue to come up with new ideas. And I would like to say that the collaboration with Janssen is a very good example in this particular case of how patients and the industry can work together on a collaborative project that is meaningful to the patient organizations and to the patients as well.